First on CNN, a new congressional subcommittee report obtained by CNN says that the FDA is not doing enough to protect Americans from unproven coronavirus antibody tests. Instead, letting dozens of companies take these tests and make them public with almost no guarantee they will work. CNN senior investigative correspondent Drew Griffin is digging in this exclusive report.
Slammed by criticism, it slowed down testing during the early coronavirus outbreak. The FDA sped up the process for the next step by allowing dozens of antibody tests to go straight into the marketplace, most without FDA authorization.
President Trump asked the FDA to remove all unnecessary barriers.
An antibody test is supposed to detect whether someone has had a novel coronavirus infection and recovered even with no symptoms. But except for a handful which have been authorized by the FDA, it's hard to tell whether the 100-odd tests out there work.
Basically, the results could be catastrophic for so many people. Just imagine someone who thought that they are somehow immune because of the presence of antibodies, and then they go out and they expose themselves and they get other people sick. This is very instructive.
Illinois Democratic Congressman Krishnamoorthi is chairman of a House Oversight Subcommittee investigating the antibody test market. Its preliminary report, obtained by CNN, says a lack of enforcement by FDA has allowed manufacturers to make fraudulent claims, that the FDA is unable to validate the accuracy of antibody tests that are already on the market, and FDA has failed to police the coronavirus antibody test market, has taken no public enforcement action against any company, and has not conveyed any clear policy on serological tests. The FDA tells CNN it is policing problem tests, citing a statement by its commissioner the day after the FDA met with the committee. We have and will continue to take appropriate action against firms making or distributing unvalidated tests or those making false claims, such as issuing warning letters requesting that companies stop their unlawful promotion. Still, the Democrats on the committee insist the FDA's actions have led to a free-for-all, tests popping up on the internet for sale. The congressional committee citing a report that a Texas emergency room spent $500,000 on 20,000 tests from China that were worthless. Congressman Krishnamoorthi says the FDA needs to act immediately and stop unverified tests from being sold.
They should clear the market.
While the FDA has not banned sales, it has set up 2 pathways to approve tests. Just 4 of those have received emergency use authorization so far, though dozens of others have applied. Meantime, companies are allowed to sell tests as long as they're clearly labeled as not FDA approved to be used only in a laboratory setting. But according to David Grenache, chief scientific officer at Tricor Reference Laboratories, the rules are vague and require doctors to read fine print.
I've seen some emails from marketers, from salespeople who are quick to sell their devices, and honestly, some of them are very deceptive. They make it, they don't make it clear that these really should be performed in a laboratory.
Health experts say antibody tests are crucial in reopening the country, advising the public who may or may not be susceptible to further infection, which is why Chairman Krishnamoorthi is adamant about making sure the tests for sale work.
I fear that a lot of people are going to continue to buy these tests based on faulty assumptions and then get faulty conclusions that could lead to dangerous life decisions.
Jake, the FDA tells us it's constantly evaluating its policies, but this policy stands. Right now, unapproved tests will be sold on the market as long as they clearly say they should not be used as a sole basis for predicting infection. An admission by the FDA that they don't think they may work. Jake?